Well, the thing I want to say about women during the perinatal period is that we have to acknowledge that this actually may not be a very happy time for a lot of people. Pregnancy can be a time of vulnerability for mental health disorders. And somewhere between 500,000 women suffer from a mental health disorder during pregnancy, but oftentimes may not get the treatment that they need. A lot of times because of the stigma, I think, that people may experience, that it's not okay to have or admit to mental health problems during our pregnancies. In general, I would say that if you find yourself not able to function, or like you're not able to take care of your baby, you're not able to take care of your normal relationships or work obligations, that's usually a red flag that there's something there that may have crossed the line into an actual mental health disorder. Either way, I think it's good to have those resources, either whether they are professional or whether they're family members or close friends, to surround you during this time to make sure that all is well. Most women should be connected to a primary care provider, and most primary care providers are very versed in helping with depression and anxiety. So that might be a great place to start, especially if you're not sure if there is a problem or not. You can reach out to behavioral health providers who offer telehealth services, and those services are just as good as in-person services for treating depression and anxiety. Absolutely. Those hotlines oftentimes are available 24/7, and they can give you good information about maybe how to manage the feelings that you're having currently, but also connect you to local resources. So we're talking about the National Parent Hotline, or there may be 988 if you're worried about an emergency or crisis in behavioral health. At AmeriHealth, we also have a behavioral health crisis line. I hate to say it's just for crisis, it's really for any questions that you may have about your behavioral health. If you've had a history of depression during prior pregnancies, you are at a higher risk of having future depressive episodes. And so it'd be important to have those conversations with your doctor. I think the message here is that postpartum or perinatal mental health problems are highly treatable, and you do not have to suffer.